Today we're going to talk about a client with knee injury. Exercises we want to avoid with a client that has a knee injury, depending on what type of knee injury it is, whether it's an ACL or anterior cruciate ligament injury, a posterior ligament injury or medial ligament injury. We kind of tackle them all the same. We want to build the strength up around the knee first before we get into anything that's going to aggravate the injury. Exercises to avoid are exercises such as the leg extension, as this puts undue pressure on the patella and the ACL at the front of the knee. Also want to avoid jumping exercises like skipping, box jumps, etc. Also want to avoid walking lunges, as this creates a shearing effect on the kneecap when you take a step forward. If you are going to do lunges, make them static lunges where the client places the foot out to the front in a controlled manner and dips directly down from the hips and repeats that without walking. Best exercises to do when recovering from a knee injury are exercises like step-ups, as this strengthens the gluteals and also strengthens the ACL, the medial ligament and the posterior ligaments surrounding the knee, and also helps with knee tracking so the client can get back to running eventually. Calf raises are also a great exercise to do, as this strengthens the lower leg muscles and helps with knee tracking also. Partial squats are also a good exercise to get your client to start doing. The partial squat is where they have a bar on their back and they do it like a quarter squat, which will strengthen all the muscles around the knee, and you're not having to put that undue pressure of going into a deep squat, so you're keeping the risk of injury to a minimum.